Thank you for staying with us. In Ghana today, our active COVID-19 cases stand at 8,395, and it continues to go up. People are simply refusing to do the basic things that they can do to protect themselves, putting many more people at risk by not doing the right things. There's a medical doctor with the Komfo Teaching Hospital, Dr. Ivy Dakwa, who put out a video warning that there's a trend, what she's seen in the facility at the hospital. She wanted to tell all of us about it, which is symptoms that people are presenting. We've tried to raise her via Zoom. We want to see if she can hear me. Dr. Dakwa, good morning to you. Hopefully you can hear me all right.
Yeah, good morning.
Okay, great. Good to see you. Thank you for the video that you did, by the way, because I go to the market, I do the salon, they're always fierce, but you actually don't know what is right. What more can the people do? So I found it very insightful. I shared it with our viewers this morning, but I wanted us to build on that. So explain, you're asking us to take towels when we're going to the salon. It's a Friday. This weekend, people will go to the salon.
Before I start, I'll say good morning to your listeners. My name is Dr. Mrs. Ivy Dakwa. I'm actually at the KNUST Hospital, not Komfo Teaching Hospital.
Okay, great.
Yes, and I'm an ENT surgeon at KNUST Hospital. So when it comes to COVID-19 or the coronavirus infection, we are aware that these viruses can settle on surfaces for a period of about 0 to about 72 hours. That's about 3 days. So I just thought it wise that why is the infection, soaring at this point? Is it because the day-to-day activities that we all go through, especially as women, are we ignoring the basic or the safety measures to take? So I thought, okay, we all go to the salons, like you said. So this is a situation where you meet, let's say, a COVID-positive hairdresser you don't know, who has been touching these towels and probably sent her mouth and her hands towards the mouth or any other mucosa, and it begins to spread. So you touch those towels as they use it to wipe your what do you call it, your hair. You touch your hair, takes it back to your mouth and that kind of thing. So I just thought it wise that no, let me advise my fellow women that why not take your own towels? What does it take? But most importantly, if you can, less frequent such places, I think at this moment it will help us a lot.
Okay. And you're also talking about the wig caps. If you have the caps, then you can make do with them in the meantime.
Exactly, because you are your own wig caps. Even with that, I would advise that when you come back from the market or wherever you go, especially when you go to places that there are a lot of people around you, you just put the wig cap, put it, in the sun for it to kind of dry for you. If you have a hair dryer, you can blow it before you reuse it another time. Yes, I think that would be very helpful, yeah.
There was also the revelation about money and how you should try and disinfect when you take monies from the ATM or if you go to the bank to withdraw money.
It's all about this surface thing I'm talking about, so far as the virus is concerned. So you go to the ATM, all right? You tap on the keyboard with your bare hand. You pick the money. You put it in your purse. You begin to reuse. I think in this age of COVID-19 and understanding the disease, it will not be advisable. So I was advising that when you stand before the ATM machine, for instance, you have your alcohol rub or maybe you have a toothpick. So you use the toothpick to press the keyboard. Take your money. The money you take, I've done it several times. The alcohol rub, it dries faster. So the money you take, you spray it, put it somewhere, it gets dry immediately, then you are safe to reuse it. These are some of the measures that we can take as individuals just to protect ourselves and protect our loved ones.
Okay. There's also the issue about people presenting not with the cold, the fever, but people are just simply losing taste. How does it happen? So I don't feel any other thing, I just can't taste.
All right, so let us go through a bit. You know that when we started with this COVID-19, we were told about there are common symptoms. we have the, let's say, people can be asymptomatic, where you don't have any symptoms at all. Then you can have the mild symptoms. Then you can have the moderate to severe. Then we have the critical symptoms. So with the mild symptoms, we are talking about your usual fever, nasal congestion, runny nose, sore throat, headache, and all that. Then you come to the moderate to severe, where we are having this kind of pneumonia-like symptoms. Then the critical is I always call them the failures. So you have a respiratory failure, a heart failure, and all that. Now, what I realized, I would say it's an observational study, because I'm talking about what I have observed at my facility at the KNUST hospital. Then I realized that apart from the flu-like symptoms, or even the gastrointestinal symptoms like the abdominal pain, the diarrhea, and all that, people have started reporting with anosmia, that is loss of smell. And then we have ageusia, which is the loss of taste. Or I would say that some people come with a bit of change in taste. I have a bland taste. I can't feel the taste of this meal. I cannot smell. And these come because they just wake up one day without any prior, let's say, catarrh or anything like that. They just woke up and they suddenly cannot smell. And I've had very close, colleagues and relatives like that. And all I was saying is that it's a bit bizarre and weird. They don't have fever, they don't have headache, they don't have anything like that. Then we decided that, okay, let us screen, because it's a weird presentation. Don't forget the disease is new. We are all studying the disease and understanding it each day. So I realized that when we screened all those people, they were turning positive. Then I asked certain friends around and said, oh, we are also experiencing that. People are turning in with loss of smell, loss of smell. Then I said, okay, let me do this to a small group that I joined to. And then before I realized it has gone viral. So that is what I've come to realize. Yeah.
Okay, so what's the advice for the many people? So if I suddenly woke up and I couldn't smell or couldn't taste, what should I do?
So if you suddenly wake up and you couldn't smell, you couldn't taste, I think the best thing is to report to a health facility. Exactly. So when you go there, they will reassess you. You understand? Because sometimes they will have to react. If you come to me, for instance, and you say, yesterday I had a call from someone who said, I cannot smell. I asked the person to join my clinic, and I realized the person could smell. You understand? So any doctor will reassess you, and there are other factors we look at. If we think that you fall into that category, why not you be screened? Because it's good to catch people early in the mild or asymptomatic stage than to catch them in the severe and critical stage, so that we avoid the high rate of the high incidence of mortality. Yeah.
Okay, just finally, I know you have to go. Is there a particular reason you are addressing women?
Oh, obviously because I'm a woman. And I think that there's one thing I wanted to talk that wasn't in the video. You know, COVID and children, you know, as mothers, we have kids at home. And then what I've come to realize is that the kids are usually present with a mild form. You know, they did the studies in China, where they said that about 4% of kids present asymptomatic. About 54 to so present with mild. Then we come to about 36 of them presenting with moderate to severe, and then we have the critical ones. But their critical ones look like what we call the multi-system inflammatory system, where there's a cascade of inflammation in a lot of organs in the body. So what happens is that the child can present with fever again. They can have bloodshot eyes. They can have bluish lip as if they are cyanosed. They can have, some sort of regress in their developmental milestone. So you have a child who has fever. Maybe you think it's a malaria as a mother. Then you realize that this is a 2-year-old child and the child is already walking. But suddenly there's extreme tiredness or weakness on the side of the child. You begin to see some kind of wheals on the skins and all that. I mean, you know that there are degrees of facilities in this country. So when something like that comes, I think that people should be alert and realize that it is better to screen such a child, because elsewhere we've realized that people with the children with the MIS syndrome usually is associated with the COVID-19 infection. So what I've realized that with the kids that are coming around, we start looking for skin changes. There's fever, all right. Some of them even present with chest pain. The chest pain that is not resolving. I mean, it's constant chest pain. And then, of course, we have kids who are sort of regressing in their developmental milestones. They feel extremely weak, some sort of weakness in the limbs and all that. These are all things that the disease is evolving into. So as practitioners and as a country, we should look at all that.
Okay. All right.
Another thing in the video that I'll touch before I leave is about the immune boosters. You know, I talked about how as individuals we can boost our immunity. And we know that the natural ones are always the best. So if you look at taking vitamin C rich food, you can get them in, let's say, the cauliflower, the broccolis, even the sweet potatoes, the green peppers, the sweet peppers, and all that. So it's good. When it comes to zinc, you can substitute by maybe getting a zinc tablet in addition. But then there's something that we call the vitamin D, all right? And over here in Africa, we know that we are about 20% of the population is deficient in vitamin D. And the studies have shown that those who are deficient in vitamin D, when they get exposed to the COVID infection, their severity is a bit high. So in other words, there's a correlation between vitamin D deficiency and the severity of the infection of COVID-19. So vitamin D, I mean, there are lots of foods here with vitamin D. So we have our fortified milk, our eggs, and all that. So I think people should eat well. And I think if we eat well and add a bit of supplements, whatever happens, we're likely to fall in the asymptomatic or in the mild to moderate. Okay. So that in all, we reduce the incidence of mortality. Yeah.
Dr. Ivy Darkwah, thank you very much for availing yourself. Thank you for your advice. Thank you for the work that you do. We wish you the very best, and we pray that you also stay safe.
Thank you, and you too.
All right.
And take care.
Okay, that's a surgeon with the KNUST Hospital. She started off with the video that went viral, and we thought, let's have a longer conversation with her so she can open up on all the other issues. So please take the advice. As you hit the salon this weekend, make sure that whoever is taking care of you is wearing a mask, and you're also, throughout the salon session, you're also wearing a mask. And take your own towel if you can. It is a must. Take your own towel from home to the salon. Please stay safe. Stay with us at your election headquarters. We've got the NPP primaries, the conversation before the primaries with the Director of Elections of the party. Roland Walker has that conversation with Mr. Evans Nimakon. Stay with us.